Hi, it's Justin Shore from Chronicles of EMS. Thanks for joining us here at the table for Seat at the Table. We've got more representatives from the International Association of EMS Chiefs.
Jeff Miller. I'm currently the Director of Simulation at Eastern Virginia Medical School, but started my career a few years back at the Alachua County Fire Rescue as a paramedic firefighter.
Dan Gerard, registered nurse paramedic. I'm the EMS operations officer for the City of Oakland Fire Department, and I'm the secretary of the International Association of EMS Chiefs.
Welcome back. Thanks for coming.
William Sugiyama. I am the EMS Division Chief for the City of Oakland Fire Department, and I'm also the President-elect of the IAEMSC for 2012.
Greg Lloyd. I currently work at George Washington University in the Office of Homeland Security, and a retired EMS Operations Chief from Worcester, Mass.
Well, thank you for joining us. As we mentioned in some previous episodes, your organization, the International Association of EMS Chiefs, is out here on the West Coast having an executive meeting, if I'm not mistaken.
Yeah.
And thank you very much for taking time out of your busy schedules to come and have a seat at the table with us. We do have a live chat room, so our audience does have a seat at the table with us. And this is an opportunity. I told the last group that a lot of times getting your own EMS administration on the phone or asking questions of them is very difficult. And so taking the time for you to come here and actually open up the chat room to the world and see if we can get some questions from them and get your answers. It's just wonderful that you take part in it. What I wanted to focus on today is moving forward in a world of politics, budget cuts. I think just coming with getting experience in the field, we realize that we can't just operate on our own. We have to have support from above. That means not just our local city administration, but county, state, and federal officials. We spoke with another panel about where EMS has come from through the 60s, 70s, 80s, and a lot of difficulties in the 90s. One of the things that was brought up was when funding was available, we were able to expand our services. Now funding isn't so available. How is the IAEMSC going to help at the federal level to try to get those methods of funding put back?
I would offer that EMS is predominantly and exclusively a local service. The federal government's role in that has arguably been probably fairly ill-defined over the years. Mm-hmm. And as a result of that, I don't think the federal government has a good idea what its role is with the local EMS system or how they play in that role. Mm-hmm. Funding of EMS systems is very different in each general locale, and certainly, I mean, you can look at states like California where that funding stream is a little bit more well-defined, but you go to some states where it's some of it is tax-based, some of it is strictly revenue-generated, fee-for-service. Some of it's volunteer. So the whole issue of funding systems really is a local issue that I just don't see the federal government doing a whole lot with. Certainly they can work through CMS and through Medicare to improve reimbursement rates and pay for the cost of being prepared, if you will, not just for the cost of transport. But that takes time to affect those kind of changes, and certainly we are working on those sorts of issues. But from the standpoint of funding systems directly to maintain operations, I really don't see that happening, and certainly historically it never has.
I would say also, Greg, that to fund something, you have to know what that something is. Mm-hmm. And each community has a different notion of what that something is, and that's well within their prerogative and should be. Communities have to decide what level of care is appropriate for their community. And it would be very difficult if we had this one-size-fits-all from the Fed saying, this is how you're going to do it. It doesn't provide necessarily the flexibility that some communities may to elect or opt out of. Mm-hmm. So, yeah, it would be nice if money just fell from the heavens. But this is tied to a lot of factors, and a lot of these have to be defined with the understanding that the factors that work well for community A may not be the same factors for B, C, or D.
May in fact cause a detriment in those communities.
It may in fact do that, but that again is a local decision. It's the citizens that make up that community and vote for those officials that make the decisions to look out for their well-being, that they have to trust in to do those things for them and define those issues and articulate them very clearly so that they can decide how to fund it, what are the right mechanisms, what are alternative mechanisms, and again, not put all your eggs in one basket.
And, well, and I think what's critically important is that with the President's Affordable Care Act, and how that legislation ultimately plays out, they kind of laid the groundwork out here that there's going to be accountable care organizations, and that EMS, for the first time, EMTs and paramedics are mentioned in federal legislation as healthcare providers. And so now it's up to us to engage with healthcare systems, for us to engage with insurance providers, for us to engage with policymakers at a local and state level to see how we fit in, how we improve care, how we improve outcomes. And once we see how we fit in delivering viable patients to emergency departments, or maybe some other delivery model system, maybe we're taking patients to alternative care sites. Once we start to develop that picture, then at that point, people have better traction on what we need in regards to funding, what system models work, what system models don't work. So, I think the groundwork was sort of laid out there for us in the legislation by specifically identifying us. It's up to us now to take the ball and move forward and engage with insurance providers, to engage with our local and state officials.
And taking a step back from my initial question, and maybe not directly legislating how we deliver our care, but is there a chance at the federal level to get more money for training? It seems anytime there's the Department of Homeland Security has something that first responders need to be aware of, there's an overabundance of money coming down for training to get everybody through the class very quickly and understand what this new hazard is. When we had to go through the WND training, it was a 2-hour class. Bomb recognition for first responders. We went through and were told what not to touch and what to touch, but trying to find funding for EMS training seems to be not at the same level. Is that something that can happen at the federal level, or should we still focus locally?
Well, I think at that point I'd have to ask you the question: what kind of EMS training specifically are you looking for? If you're looking for things to come out of DHS, obviously it's going to be training specific toward incident management. It's going to be training specific toward chemical, biological, sea brine emergencies. Specifically, what kind of training are you looking for?
Bridging the gap between current BLS instruction and where the new standard of care is moving, trying to get 12-lead standardization throughout the nation. Some communities do it, some communities don't, but I think it's still a skill that should be known. To all the paramedics, they're still not getting it in their basic paramedic program.
Well, you bring up an interesting point there. If you look at, that standard of care is really, it's almost 20 years old. That was brought up by the National Heart, Lung, and Blood Institute. That was identified in the early 90s. Like 91, 92, there was a whole series of documents, and that was pushed out by the NIH, by the Department of Health and Human Services. At that point, some of the manufacturers of 12-lead equipment stepped forward, offered 12-lead courses, and kind of pushed things out there. If you look at different communities, there were communities prior to the development of the current models of 12 leads, and I don't care what manufacturer you pick, all right, they were actually using hospital 12-lead machines and taking them out into the field and then faxing that 12-lead over an analog cell phone to the hospital, to the emergency department. That was like 91, 92, 93. So I think that at a local level, we kind of dropped the ball because, some communities were doing it and some communities are late to the game. And the communities that are late to the game, now if you want to, if you expect the Fed to, to step in, they identified this in 92, 93. you know, that's when we should have been asking for a training package or some type of support at the federal level to come out. I mean, here it is, it's 20 years later. You know, they identified the fact that this needs to be done pre-hospital care level. You know, we need systems in place. I mean, like I said, those documents are 20 years old.
Yeah. So we're not looking to the federal government to tell us how to deliver our service. We're not looking to the federal government to help us necessarily to train our people. We're not really looking for them to directly support us. What kind of indirect support, or what kind of support can we hope to get from the federal government in EMS? Is this just something of getting EMS back into the everyday conversation when it comes to public safety and public health? Or is there a larger goal that we could be pushing towards as a group at the national level?
I think the reasonable expectation is to understand first and foremost the role of the federal government. We live in a federalist government. The Constitution is very clear on states' rights. Mm-hmm. The states set the standard for their individual communities, whether it be for public health, whether it be for the practice of medicine. They have a process, each state goes through it. The federal government's role in that is really supportive, okay? And like with law enforcement, and like with the fire service, on fire suppression issues, they can cajole, they can provide education standards, they can provide support for training development, for improving the national standards, but it's really up to the locals and the states to take responsibility for what they want to have accomplished. I think the issue of what goes on as a practice or as a policy and a doctrinal issue surrounding domestic preparedness and preparedness for all hazards and the post 9/11 terrorism environment, those are very separate and distinct issues from a national policy on supporting EMS. Mm-hmm. They cross, certainly, and there's certainly places where they can be complementary, I think. But I think that I think there's an unreasonable expectation that all the best answers are in Washington. The best answers are here.
Absolutely, and every community will have its own unique
Absolutely.
Answers. Even in just looking, one of the examples I give is the system in Oakland will never work in San Francisco and vice versa, because you have two different geographies, two different communities, and we can't take the perfect system and photocopy it and send it out. Not at all. I guess what I'm trying to get at is, do federal lawmakers have a role in shaping EMS in the future? And if so, what is that role, and how can I help the IAEMSC reach those goals?
Well, I think let's pull another fascinating example back, because this may help the discussion. Let's go back to the education piece. Mm-hmm. You know, should they be providing our training and education? It's fascinating that the National Standard Curriculum come out of the NHTSA. Right? Let's go back and look at medical education. Where does that come from? It comes from the ACGME, right? The Association of Medical Schools. Mm-hmm. We look at nursing. Does that come from the Federal Office of Nursing? No. We're one of the very few health professions around anywhere that has educational standards kind of directed through a federal office, rather than the professional organizations and associations that represent that body. So in a way, we're kind of allowing people to tell us what we should be doing in some cases. You know, and albeit I understand that they do incorporate and use a lot of the bodies. But, excuse me, ultimately it's coming through that office, which sends kind of a weird message in that, you know, perhaps we're not taking enough personal responsibility for our own education and advancement within this field. You know, I think Greg is very right on in this, that, you know, perhaps our role is simply to be there, you know, to provide support or coordination when needed, but, you know, it's going to take professional organizations coming together with a clear vision and mission around whether it's EMT education or you know, better protective devices or safety standards, and making sure that we're articulating this very clearly through the states and to the federal government, but not waiting for them to come tell us how this should happen.
I mean, at the federal level, you know, I mean, we probably, just as they identified systems for trauma systems, and they were very instrumental in the development of the first trauma systems in the United States. And they tried to do the same thing. They tried to identify that with cardiac systems and STEMIs in the early 90s. But, you know, it didn't have the same level of push. It didn't have the same level of enthusiasm on a federal level. Just to go back to something that Jeff talked about in regards to NHTSA, and I mean, this will make everybody in the room crazy for a second, but so, you know, we have a federal office that purports an educational standard and a curriculum, but of all the healthcare professions, so you would think that it would be easy to be, you know, I'm a paramedic in California, I could also be a paramedic in Iowa or Texas or New Jersey or Pennsylvania, and that isn't the case. You know, it's easier if you're a nurse or a physician, your license accreditation is easily transportable across state lines. We have a federal curriculum. You know, the curriculum comes out of the Department of Transportation, National Highway and Safety Transportation Administration.
Mm-hmm.
So you would think that it would be easy, right? It's coming out of the federal government, and yet that just doesn't exist for us.
And at the same time, you can go to the National Highway Transportation Safety Administration website, and you cannot link directly from their site to any EMS documents. So we are a profession trapped within a trade, trapped within a federal organization that isn't exactly sure where we fit.